at how I drink out of this water bottle.
That's cute.
No, like this.
Oh, well, that's how I drink out of mine too. It's for lip flip girlies.
Is a good moisturizer for acne-prone skin? I love that question.
That's a great question.
Yes, there are so many good ones. Cetaphil makes one that's oil-free. I personally do not like it because I don't have oil. I don't have acne-prone skin like that.
Yeah.
But that's a good moisturizer. Neutrogena has an oil-free moisturizer that a lot of people like. Love La Roche-Posay.
You love La Roche-Posay.
Double Repair.
That's
Tolerian. Is that how you say it?
Tolerian.
Tolerian. But now there's one for acne-prone skin, which is blue. The one that Jillian and I usually like is white.
Oh, the blue one. Oh,
the blue one is the one.
You know, the only thing I don't like with the
oily
blue one
skin.
is it pills.
Interesting. I don't like the blue one. I like the white one.
You're pretty, Dr. Claire.
Oh, thank you. What I want to tell you is moisturizer is not going to help your acne. It's not a moisturizer fighting acne. It actually, a lot of times, this is kind of counterintuitive. You want a moisturizer that's hydrating and something that's really soothing, because we're going to throw medications like salicylic acid, benzoyl peroxide that are irritating. And so you need to rehydrate the skin so that it can take those acne meds.
Yeah, totally.
So rather than using like such an oil-free one, you might want something thicker.
Dr. Claire, what's your favorite sunscreen while on Accutane with no white cast? I love that question.
With no white. Such a good question.
With no white cast.
If you're willing to do tinted, I love the Elta MD Elements tinted.
What about Elta MD not tinted?
UV Clear is
the UV
a great
clear.
option
I
for
like
Accutane
the UV.
because it has 9% zinc and it's clear. So those are probably my two favorites. If you're okay with Elta MD brand.
Me too.
If you want a different brand, that's fine. There's so many good ones. Just let us know and we'll give you an idea.
I love
that.
Elta MD is what I use after every laser or chemical peel. It's like the only one that doesn't burn.
Right. Well, the UV Clear has some chemical in it, but the tinted Elements doesn't. That's the difference.
Oh,
but you're not going to have a no white. Elastin.
Elastin's
more expensive.
good.
Sorry, but Elastin Mineral has a very, very. It is a tiny bit white, but it's not super white, and it's 20% zinc. I really like it.
Okay, doctor, all facts aside, you are flat out. Oops, wait, it disappeared.
Oh, no.
You are flat out gorgeous.
Aww.
That hair is silky as the old Silk Road. Fine, and she is fine as wine.
So nice.
You
I
are
just had my hair did.
You are
so
super
thank you.
hot.
Profound is
Profound.
Profound RF. Here's how I feel about radiofrequency. Microneedling, radiofrequency, lots of different names, Cutera Secret, Profound RF, Morpheus 8, all these things are similar. They're supposed to really work on texture. Definitely a better option if you're a darker skin tone, safer than a fractionated laser. Not better necessarily than a fractionated laser. And the skin laxity thing, I don't know that it really works for that. Nobody has really told me that they're seeing huge benefits to skin laxity with these microneedling RF devices.
I've never heard anyone say that tightening has been a
sucks.
benefit.
We suck at tightening as dermatologists.
Can nose filler migrate? I want rhinoplasty, but it's so expensive.
Let me tell you, filler in the nose can cause blindness, and there's a lot of good ENTs. Like, we love facial plastic Dr. Ben Paul, and he doesn't do filler in the nose because he says it's too risky.
He says it's too dangerous, and he's like literally the facial genius.
If he's scared, I'm really
You're
scared,
really
because
scared.
he's an actual trained ENT, which means he knows. He's a surgeon, and he spent 6 years in his training looking underneath the skin at the anatomy. And if he's scared, I'm scared.
He thinks it's too dangerous.
I just wouldn't do it. I don't think the migration is the issue. The issue is the occlusion.
Yeah.
Not seeing a lot of benefit. Remember, you're adding, not taking anything away.
Right.
So most of the time that you're not an appropriate candidate. The only people that are candidates are people who have a big hump and they're trying to morph that hump, or someone who wants like a thinning or a little increase in their bridge.
Exactly.
I would just avoid it. I'm not into it.
Just saw a scary TikTok from Dr. Amir about filler being super bad, never dissolving.
Oh, that's a good one. That is true. Filler doesn't always metabolize. That's scary truth. There are some people that are fast metabolizers, and it's a huge waste of money, and they look like they never had anything done 4 months later. And there are people like me who hold my filler beautifully, and I really haven't had to do a ton in the past year. And I bet if you opened up my face for a facelift, if I ever were to do that, you would see globs of filler. So I'm going to reverse a patient of mine coming in who's decided to go for a facelift. It can be dissolved with a ton of enzyme, and we're going to do that before she goes for her facelift.
Oh, that's a good question. Do you have to dissolve all your fillers before a facelift?
You should. I think that's where people are seeing these images of plastic surgeons cutting into faces where the patient gave them information that they haven't done fillers in 20 years or whatever.
But it's there.
And they have filler.
Does it cause a complication if you happen to have filler and get?
I just think it complicates the surgery. It's just better not to have it. Start fresh. You don't know what you're dealing with. Dissolving filler in the middle of a surgery is not a good idea.
I'm gonna need a neck lift pretty soon. And
No,
when
you're
they cut
not.
open my neck, it's gonna be like
You're
a
not.
thick.
You're not
It's gonna
going
be
to.
so much Botox and filler
No,
hidden
your neck
inside.
is not concerning to me. I think they were finding a lot of filler in the cheek area.
If you're claustrophobic, will Botox around your eyes make you freak out?
No, it is a little odd when you have Botox around your eyes and you try and squint for the first time and you can't. But that happened to me my first time.
Really?
Yeah, the sun was in my eyes.
I don't get
couldn't
Botox
squint.
around my eyes.
You don't
so I
really.
can
A
squint.
little sometimes, but not frequently. Sometimes I have given you it.
You have?
But not a huge dose. I don't
You
think.
can't squint. You're squinting.
It feels weird. It's
Oh,
pulling.
you
It's like
can feel
trying to
it.
cry. Have you ever had a Botox cry?
What's a well, Kim Kardashian has those on TV all the time. It's like this.
I think this moves, but
with
this
the
doesn't
tears
move.
falling down.
It feels really tight.
She's
when
a
you cry.
beautiful crier, honestly.
I don't like my face when I cry.
Best over the counter for eczema, especially around the antecubital
Can I
area.
give you a little tidbit? Do not buy anything over the counter that says it's for eczema. It doesn't work
Yeah.
as well as some other products.
Totally.
It is all marketing.
All marketing.
And the things I like the least from brands are the things that say eczema relief.
Yeah, I agree.
The Cetaphil eczema relief.
Y'all, it's all of skincare is marketing. So you just have to know who to trust and who not to. But eczema, like especially when it says in the huge bold letters, it's kind of just a moisturizer, right?
Yes, there's nothing special in the eczema products.
So
and the truth is, you want a thick product. You want something hydrating.
Yeah.
If you have eczema, your hot spots, you should get an ointment like Aquaphor. Or there's a CeraVe ointment right now, healing ointment. Try that.
I like that.
Something that's, or plain old Vaseline, cheap as dirt. Petroleum jelly. You know that thing slugging people are doing on their face? That's actually the best. Those products, those ointments are the best thing for eczema in your hot spots. I know you're not smearing that all over your body. And then you can look for a tub of something with urea in it, like the Eucerin roughness relief or advanced repair.
I love Eucerin.
Like those Eucerin products.
And all of those tubs, there's Aquaphor, there's the CeraVe healing ointment, and Cetaphil healing ointment. And they're all the same. They're all kind of like like Vaseline, but a step up. But they're lovely.
They're great.
I keep it in the fridge because
And
they're nice and
something
cold
thick.
to put on. I think they feel
That's a great
great.
idea.
Baby Botox for a 23-year-old. What do you
I
think?
love that question. I can't comment on Botox based on age because I have 23-year-olds who have more wrinkles than 40-year-olds that are better candidates for Botox than a 40-year-old.
Genetics.
It's how you move your face. It's how expressive you are. You do not need to do baby Botox so that because you're 23 and you're feeling like, oh my God, I'm
But also tell everybody baby Botox just means less Botox. That's
it's
it.
just little bits of Botox.
Yeah.
And the problem is that it's being overused by people who are charging 23-year-olds who didn't need Botox in the first place. Because when do you need Botox?
Yeah.
You need Botox when your lines are slightly present at rest. When you crinkle your forehead and you stop making that movement and the line is still slightly there, you need to go to the dermatologist and get Botox. You don't need to do it 5 years before that moment.
Yes.
You're just gonna waste your money.
100%. What is eczema? Can you explain that?
Eczema is a condition of compromised skin barrier. So you have genetic predisposition to not having all the building blocks that should be in your skin, which leads to some water loss, and the skin is more open and dry, and that leads to dry skin, which leads to inflamed skin, and it looks red and rashy, and it gets worse and worse. It starts mild, then it gets moderate. If the skin is inflamed, you typically need a steroid ointment or something that's anti-inflammatory, if not a steroid, to treat that eczema skin. But going forward, because it's a chronic condition, you want to make sure that you're repairing and restoring the skin barrier to prevent flares. And that's in the form of hydration. That's where a moisturizer is really important. And ointments are more hydrating in these kind of patients than a light lotion.
It says they've been on spironolactone for 5 weeks and their acne is getting worse and more painful. Any advice?
Can take 2 months to work.
Yeah.
If you're taking 25 milligrams twice a day, that's the appropriate dose for acne, but you can try 50 twice a day before aborting. If you're saying that you're failing spironolactone, it could be because your acne isn't driven by hormonal changes, particularly testosterone, which increases sebum production in the glands. And that's fine. That just might mean that's not one of the factors in your acne, and spironolactone is not an option. But I would give it 2 months and maximize the dosage per your dermatologist before calling it quits. Because if you're not a candidate for spironolactone, you're really looking at Accutane. That's it.
Yeah. Seeing a bunch of eczema questions, like eczema on the face, cheeks, eyelids, someone says. What about when your eczema's on the face? Is that still Aquaphor and everything, Dr. Claire?
You need medicine.
You need medicine,
people
first of all.
are trying to control their eczema. They're scared of steroids because I think their social media is making people scared of steroids. Steroid creams have worked for a bazillion years. We have good data showing if used in the correct way, which is use it daily and then stop and decrease how much you're using and go back to your maintenance of moisturizer or non-steroid creams.
Yeah.
You're safe. The fear is thinning the skin from repeated use if you use it daily for years and years, but you're not using it daily for years and years.
Right.
You're using it when you flare, and then when it's better, you stop and you use something else. And there's lots of anti-inflammatory creams besides steroids that you could get from a dermatologist. So don't try and manage your eczema from over-the-counter moisturizers. You don't have to suffer. You can go to a dermatologist and they can give you a prescription, and that will probably clear your skin.
Yes.
And then you'll have to use your moisturizer as maintenance.
People are quicker to spend all of their money
On beauty.
at like a drugstore buying everything they possibly can, whereas they could go to a dermatologist for a medical reason. It could be covered by your insurance, and you could get a prescription for $15 for your issue instead of buying out Dwayne Reed for.
I think it's suspicion of that dermatologist or what doctors are driven by the wrong reasons.
Yeah.
Nervous about what it's going to cost them.
Right.
And
they should be more suspicious of 20-year-old TikTokers being like, this cured me. Be more suspicious of that than a doctor.
And I also think another issue is that people don't think it's so bad that they need to see a derm.
They'd rather spend all their money at the drugstore.
And if it's bothering you, then maybe you could be helped by a quick cream. You don't have to try and solve it yourself.
Yes.
That's why we went to school, to help you.
I spent 12 years in residency so that I could help you
As an actress.
Please follow. All right, bye. Love you guys.